Our next speaker is Dr. Joel Solano. He's a fellowship-trained glaucoma specialist and co-founder and chief medical officer of I See Better, which he's here to tell us about. Welcome, Dr. Solano.
Thank you. Thank you, everyone, for the opportunity to present at this forum. You're a physician explaining to a new patient that they have glaucoma, and all you get in return is a blank stare. This happens to us as physicians all the time. My name is Joel Solano, and I'm a practicing glaucoma doctor. I'm also the chief medical officer for I See Better. I'm here today to share with you our solution to transforming the moment of diagnosis in order to improve outcomes. We're fighting a disease that's known as the silent thief of vision, and half the people with this disease don't even know they have it. We can't exactly say we're winning the battle. Our mission at I See Better is to improve outcomes, which we define as not just preventing vision loss, but combined with empowering patients and improving their quality of life. As physicians, we're taught that in order to improve outcomes, you first have to make the proper diagnosis and then prescribe the proper treatment for that given diagnosis. At I See Better, we feel that's not nearly enough. If you really want to improve outcomes, the most impactful way lies with what happens to the patient when they leave the doctor's brick and mortar office. Since 99.9% of patients' lives are spent outside of the doctor's office, we need to go to that portion of their lives if we're going to change outcomes on a large scale. To a patient, their quality of life is a far more tangible thing than intraocular pressure or visual field progression. As physicians, we spend so much time trying to arrest nerve damage that we seldom get insights into how patients are actually living with their disease. If we're going to improve quality of life, we've got to empower patients, we have to educate them, we have to teach them what to expect from their disease processes, and at the same time, they need help with care coordination and medication adherence. Patients across all specialties struggle with medication adherence, but those with glaucoma struggle more so because of the chronic and largely asymptomatic nature of this disease. Adding to the issue is the associated anxiety and depression that comes along with the fear of vision loss. And these mental health factors further weigh negatively on medication adherence, which creates a vicious cycle towards more vision loss. These patients need our help. We can't expect them to continue to take care of their disease alone. We believe that we need to move our efforts into the patient's daily life and beyond the walls of our clinic if we're going to change the dynamic towards measurable improvements in outcomes. At I See Better, we've created a platform that involves and integrates patient care coordinators to help patients on their lifetime journey with this disease. We've taken lessons learned from other specialties and are now pioneering remote care in ophthalmology. You're the first audience to hear how we use our team of patient care coordinators to leverage technology in a large-scale solution to improving outcomes. Our patient care coordinators are in place because we believe that you still need humans when delivering healthcare if you're going to make it most effective and keep it personalized. The care coordinators keep the care personalized, but we use technology to leverage and scale that personalized care so that we can deliver more of it. We apply the multifaceted approach required to keep the patients engaged, grow their medication adherence, and ultimately improve their quality of life. Our methods mirror the CMS guidelines that are in place, including principal care management, remote therapeutic monitoring, and remote physiologic monitoring. We work within the guidelines of the registry to always remain in full compliance. We've brought onto our team expertise in behavioral health to help us develop our proprietary patient engagement techniques. These techniques include gamification as well as artificial intelligence to help us identify what each individual is driven for on our platform. We've also created a proprietary Living with Glaucoma wellness examination called C-Well. This patient inquiry involves several health categories, including medication adherence, activities of daily living, activities of independent living, fall factor, as well as the social and behavioral well-being of a patient. The C-Well algorithms also work to assess the patient's why in life, what drives them, what are they motivated by, so that we can use those things to encourage them and remind them to remain persistent with their therapy. If our AI starts to notice that a person's grandchildren are particularly important to them, then we'll send them a nudge to say, hey, remember you're doing this to preserve your vision, which is more time to see your grandchildren. These methods and techniques improve not only medication adherence, but medication persistence. Because we believe it's important to treat patients as a whole and not just as a disease, we've also brought onto our team a staff psychiatrist to help us address the growing and unmet need for mental health wellness in ophthalmology. The iSeeBetter platform has built-in remote therapeutic monitoring with compliant reporting back to you, the physician. When you refer one of your patients to the iSeeBetter ancillary care platform, you're going to receive in return a month-end care report. In that report, you're going to see all the care that was delivered to your patient, as well as the time spent delivering that care. Along with that care report, you're also going to receive a billing eligibility report. You will review that, approve it, and then submit it for reimbursement to the work that you're doing supervising the care being delivered to your patient. At iSeeBetter, we believe that delivering care when patients leave the doctor's office requires a partnership. Doctors can't do this alone. There's just not enough time. There's already way too many patients for not enough doctors, and this ratio keeps worsening. At iSeeBetter, we believe that the ancillary provider should be responsible for delivering that remote care that should be taking place when these patients leave our offices. To recap, iSeeBetter is launching its first-to-market remote therapeutic for glaucoma patients. Our platform was designed to improve outcomes, grow medication adherence, as well as address how patients are living with their disease. Our program works within the CMS guidelines so that the enhanced patient care and improved outcomes also means additional revenue to you on your existing patients. If you're interested in learning about how this program works, please scan the QR code at the top of the screen or stop by our booth here at the meeting to learn more. iSeeBetter's wearable and its remote physiologic offerings are currently in the pipeline, and we're raising capital for those ongoing efforts. Please contact us if you'd like to pioneer this together. Remember that we're all here with the same goal. We want patients to not lose vision, and we want them to live better lives. Thank you.